Functional imaging in migraine is probably done more to aid in the rehabilitation of the condition into mainstream neurology, perhaps than almost anything else that happened in the immediate past history of the condition, because it points neurologists, physicians, patients to the brain as the responsible organ, and that's what neurologists do. It provides a way of thinking, broadly speaking, about the pathophysiology of the condition that gives it a certain element, you might say, that's concrete. So functional imaging has shown us that, shown the same basic structures change during an acute attack of headache, be they a patient with episodic or chronic migraine, so that's been important. It shows changes, that subtle structural changes, not lesions, but markers, you might say, of the pathophysiology. Most recently, what functional imaging's done is given us a way to start to think about the biology of the premonitory phase or prodrome of migraine, which leads us to look at areas in the hypothalamic region, for example, in the midbrain and in the pons, all of which start to give you a way of thinking about the earlier stages of the attack. One other important thing that functional imaging has done in the context of migraine is really expunge guilt from the blood vessels. It's quite clear that the idea that migraine is due to vasodilation and its treatment is about vasoconstriction is just wrong. When one carefully looks at what blood vessels are doing in migraine, there's no relationship to any change with pain. They don't necessarily dilate, and they certainly don't necessarily constrict with treatment. So functional imaging has not only put migraine firmly in the brain, but you might say it's taken blood vessels off the hook.